Title card, Stony Brook Medicine, Maternal Fetal Medicine Fellowship.
The philosophy of the Stony Brook Fellowship is to be a great academic clinician.
Kimberly Herrera, MD, Fellowship Director and Associate Professor.
The second thing would definitely to allow the fellows to be both diverse in their research projects as well as educational opportunities, to allow them to participate both within the department and across the university. And the last is just to be trained as a well-rounded MFM, so to be able to be a consultant, to be able to man labor and delivery, run an ultrasound unit, and to follow patients as well as in the outpatient setting.
Title card, Stony Brook Maternal Fetal Medicine Fellowship, Renaissance School of Medicine, Stony Brook University. Emily Stetler, MD, 2025 Fellow Graduate.
The best thing about Stony Brook is the people, for sure.
It's a very positive environment.
Bijal Parikh, MD, 2024 Fellow Graduate.
And one in which they very much want you to succeed and do what you need to do to become the specialist you want to be.
All the MFM attendings and staff as well, the fellows seem very welcoming.
Omar Abuzaid, MD, 2023 Fellow Graduate.
And seemed like a family.
We bring the fellow to any activities that we might have or any assignments.
Cecilia Avila, MD, MPH, Attending Physician and Associate Professor.
They have a broad exposure to the antepartum complications, labor and flood complications, postpartum complications, and fetal anomalies.
Stony Brook MFM Fellowship is different than any other fellowship out there
Tiffany Yang, MD, 2025 Fellow Graduate.
because of the family feel that you get from the people around you, from the ultrasound technicians to the residents, the faculty members. They truly make you feel like you're part of the Stony Brook family.
Chapter title card, why choose Stony Brook for your Maternal Fetal Medicine Fellowship?
I chose Stony Brook for my fellowship because of the well-rounded program that Stony Brook provides. There's a large MFM department and wonderful research opportunities.
What drew me to this fellowship was that I wanted to be at a regional perinatal center
Anna Fuchs, DO, 2022 Fellow Graduate.
because I thought that would give me the broadest clinical pathology. I also liked the surgical experience that was offered here, and I felt that when I interviewed here, the attendings here were so open and personable and friendly that I fit in well in that environment.
I chose Stony Brook because it's really one of the most supportive learning environments I've ever been a part of.
Chaitali Korgaonkar Charala, MD, 2027 Fellow Graduate.
I did my residency at Stony Brook in OBGYN as well, so I had a lot of exposure to the MFM division, and we really just see an incredible breadth of pathology here, and I really just love that teaching is always the top priority.
I chose Stony Brook for my MFM fellowship
Rachel Lee, MD, 2026 Fellow Graduate.
because I loved working with the attendings and residents during my away rotation.
I chose to come to Stony Brook because of how comprehensive and well-rounded the fellowship program was. I wanted to be somewhere that was at an academic center with a community feel. I had heard of how positive the work environment and culture was, so I was very excited to join the Stony Brook family.
I chose Stony Brook because everyone in the interviews was super warm and engaging.
Samantha Gobioff, MD, 2027 Fellow Graduate.
They really made me feel welcome right off the bat. And the patients have such interesting and a wide breadth of pathologies, and I knew that I would come here and learn everything that I needed to.
I chose Stony Brook for my MFM fellowship because the program is very well-rounded and comprehensive.
Zenobia Gonzalez, MD, 2025 Fellow Graduate.
I also sensed that the program really valued education over service, and the attendings fostered a supportive and positive environment.
There are several strengths to the MFM fellowship here at Stony Brook Hospital.
James Bernasco, MD, CDE, Attending Physician and Professor, and Director of the Suffolk County Regional Perinatal Center and Stony Brook Diabetes in Pregnancy Center.
The primary one is the diversity of patients we have here and the different pathologies we have as well. We see the whole spectrum of maternal fetal medicine, from medical complications to fetal diagnostic issues. And of course, we have a very busy labor and delivery suite that our fellows are very actively involved in. We have a very large population. We are the Regional Perinatal Center for Suffolk County. which basically means that all the community hospitals in Suffolk County of New York actually refer patients to us, both mothers as well as newborn infants. And the relationship between the residents, the fellows, and the attendings is excellent. This is not a inner city location where you don't have space. I live in Suffolk County myself. I think Suffolk County and our program is really an excellent destination for any aspiring fellow.
Chapter title card, Education and Research at Stony Brook.
The educational curriculum is very comprehensive for the fellows. We have protected time weekly where we do a variety of educational lectures. We do ultrasound conferences twice a month. We also have formal didactic lectures every week. And then we also have the opportunity to give presentations in a multidisciplinary nature with the neonatology department, and that has also been a very enriching experience.
I think the environment at Stony Brook is a true university setting in the fact that there are many subspecialties available. There are people doing research in various areas in this institution, including the undergraduate institution, because there's a lot of research that occurs.
David Gary, DO, Associate Director of the Fellowship, Director of Maternal Fetal Medicine, and Professor.
In that part of Stony Brook itself.
In terms of research experience, I feel that the unique thing about Stony Brook is the mentorship and support that the program provides. The attendings really provide us guidance from IRB submission to abstract submission and publication.
My research experience here has been great. I'm only 6 months into my first year, but I've already gotten started on my thesis. I've had great mentors guide me through different types of research opportunities, different techniques, study designs, and I came from a pretty limited research background.
As far as research here at Stony Brook, one of the biggest strengths that we have is our multidisciplinary collaborative research work.
Cassandra Heiselman, DO, MPH 2021 Fellow Graduate.
I work with a wide variety, both as a fellow and now as attending, with people from across campus, with computer science, with IT, with psychology, psychiatry, and what's really wonderful is how collaborative everyone is.
I think we offer a lot of research for the fellows in this program.
Jennifer Choi, DO, Attending Physician, Associate Professor, Labor and Delivery Director.
I think the strengths of the program is that they can take their interest and have people who can support them with that interest.
Our research experience includes a second-year biostats course that we take both in the fall and the spring.
Rachel Lee, MD, 2026 Fellow Graduate.
And we also have a lot of support in our research endeavors from our attendings as well.
In terms of research experience, I think that we have a unique opportunity to really be able to do whatever we want, and the resources are available to us. If we wanted to do more translational research or bench science work, we have access to Stony Brook University and their medical school, so we can easily get involved in any of their labs. We have great relationships with other departments where if we wanted to do multidisciplinary projects, that's also available to us. We also have great mentors within the division that are very productive in research that can help guide us along the way in terms of fostering our research education and helping us create a thesis.
Chapter title card, Ultrasound Unit at Stony Brook.
Over the years, the interactions with the fellows and the sonographers have been pretty close when they rotate through the ultrasound unit.
Stephanie Perry, RDMS, lead sonographer.
We really get to know them, they really get to know us, and over their fellowship, we become a close-knit family.
Ultrasound is my favorite rotation that we do as a fellow. The ultrasound department is extremely supportive and they cheer you on every single scan you do, and it feels like a whole team is behind you.
My experience with ultrasound has been phenomenal. I think that there's an excellent pathology at Stony Brook, so being able to learn what normal is and then seeing a variety of abnormal has been very, very helpful. We also do ultrasound conferences every month that also help enforce some of the didactic nature of ultrasound, and we get a lot of hands-on experience during our ultrasound training.
We have amazing ultrasound techs that help teach us and give us feedback on our image acquisition, and so we have a great relationship with them.
My experience with ultrasound has been fantastic. The MFM fellows get a lot of hands-on experience from scanning patients to reading ultrasounds to counseling patients about abnormal findings. We also have a lot of ultrasound-related didactics. We have ultrasound conference twice per month, as well as procedure simulations throughout the year. And the great thing is that MFM fellows have access to the obstetric ultrasound simulator at Stony Brook's Clinical Simulation Center.
Given that we are a regional perinatal center, we get referrals for many fetal anomalies that you wouldn't routinely see just being one isolated hospital. So I think it's an amazing opportunity to be able to see as much pathology as you can over the course of 3 years. The sonographers that we work with are excellent. They love to teach. They take you under their wing from day one, and you really come out of fellowship being comfortable doing sonogram and understanding what's normal anatomy and what's abnormal anatomy.
Chapter title card, Maternal Opioid Management Support, MOMS.
The Moms Clinic was started in 2016 in sort of a reaction to the pandemic that we're seeing in Suffolk County for opioid use disorder. We are the #1 county in New York State for opioid use disorder. And as we know, that doesn't discriminate amongst pregnant women, and so a large proportion of our patients are affected by this disease.
We have come up with a program to support these women and provide prenatal care, as well as medication-assisted treatment and psychiatric support in a sort of seamless way that makes them feel that they're just here as a regular patient. They're not walking into some, special clinic, or they're not being put down. You can't tell the difference between this patient that has opioid use disorder and someone who doesn't in our program.
Another unique thing that the fellows get exposed to is prescribing buprenorphine and maintenance therapy for opioid use disorder in pregnancy. It's a unique thing that they get to learn how to deal with both withdrawal and starting people on and having maintenance medication for these moms.
Chapter title card, what is your relationship with the residents?
The relationship between the fellows and the residents and our teaching relationship is great. We work with them on L&D every single Monday, and then we have multiple rotations in the hospital and then work with them outside the hospital as well. So there's great opportunities to teach one-on-one doing surgery, one-on-one going over, different evidence-based articles. I think we also we're quite close with them.
The relationship between the fellows and residents is great. We're one big family. We work with residents very closely, both on the inpatient and outpatient settings, while we're covering labor and delivery, the antepartum unit, and high-risk clinic. And we really get a lot of time to teach the residents and also to collaborate with them on research.
We get a lot of FaceTime with the residents in the inpatient and outpatient setting. In the inpatient setting, we work with them on the labor floor, so there's a lot of moments for informal education. We also do lectures with them throughout the year, which they really appreciate. In the outpatient setting, we cover high-risk clinic with the residents, and we have the opportunity to serve as the attending and really talk about complicated patients before clinic starts and do education with them, and then also give them the opportunity to make their own decisions and giving them guidance along the way.
We love working with our residents. They are like our friends, but they also treat us with respect as a junior attending.
My relationship with the residents, I think, is really wonderful. I love being in a mentor role. They're very receptive to everything that I have to offer and teach, and I couldn't be happier.
We work very closely with the residents, and the fellows pride themselves on the positive and nurturing relationship we have with the residents. We do a monthly didactics with the residents to review topics in maternal fetal medicine. We operate with the residents directly. We round with them on antepartum, and we also serve as mentors for the residents in their own research projects and their own goals of pursuing fellowship. So I would say that the residents here are excellent, and we have wonderful relationships with them.
We as fellows have a fantastic relationship with our residents. We have an opportunity to share surgical cases, which is an excellent avenue for shared learning. And we also have a lot of informal and formal teaching opportunities that help us to be, junior attendings as we should be. And I think it's a really enriching experience for both parties.
Chapter title card, what is your experience with invasive procedures?
I did my first invasive procedure here. This is during my first week or first and a half week of fellowship. I hadn't done an invasive procedure before. I've watched many. The good thing is I obviously knew what I was doing, but I had chief fellow there and my attending there to kind of guide me along the way, but at the same time give me room to perform the procedure myself and allow me to learn and then give me appropriate feedback to improve my skills the next time.
My experience with invasive procedures has been amazing. When I first started, I was very nervous holding a needle and did not understand the three-dimensional nature of performing invasive procedures. And now I'm halfway through my fellowship and feel very, very comfortable performing amniocentesis and CVS procedures. And when I talk to my friends that are doing their fellowship programs at other institutions, I feel like with all of them, I'm on par, if not ahead of where they are in their training.
Our experience with invasive procedures has been excellent. We start doing procedures pretty much day one. I did my first amniocentesis the first week I was here. You start by, watching one, and then pretty quickly we get involved with doing them one-on-one with the attending, going over different techniques with each attending. We have a simulation lab as well, which has been very helpful.
Chapter title card, High Risk Clinic at Stony Brook.
The high risk clinic
Aisha Hussein, DO, attending physician and assistant professor.
is actually a good resource for the fellows because they actually act like the attendings. So it's a good resource for them to be able to monitor the residents, kind of guide them to what they should be or should not be doing. And if the fellows have questions, they always have a backup as the MFM attending there. So it's a great opportunity for them to see what they'll be able to do in the future.
One of the real advantages of the program here is the fellow does not have to be running from patient to patient as they may have been accustomed to as residents. They are starting to work as consultants. So the residents see patients, present the patient to the fellow as well as the attending. The fellow is part of the discussion that ensues and then comes up with a plan. So it's great in the sense that a lot of the routine mundane work that you had to do as a resident, you don't have to do as a fellow or as a trainee, and you actually have time to think carefully about what it is we're doing, think carefully about what it is you think should happen, and you can actually develop a huge knowledge base and develop your style as a maternal fetal medicine specialist.
Chapter title card, what do you look for when you interview fellows?
I'm looking for a well-rounded fellow who has specific career goals, who come in with a bright smile and with a good attitude.
Well, the main thing I'm looking for really is attitude. All right. It is not our expectation that someone applying for fellowship is already a maternal fetal medicine specialist. You're a resident, you've been well trained in routine obstetrics, and what you're doing differently now is getting that additional knowledge and training that makes you a consultant. Therefore, you don't need to walk in with well-baked ideas about research. We have active research. We will listen to your interest and try and direct your interest to bring them to fruition. But we also have active programs, active research going on that the residents and the fellowships benefit from.
For a fellow, we're trying to find a person that will fit into our group well, someone who can get along with everyone, someone who is striving to achieve goals that they have on their own.
When we're interviewing fellows for fellowship here at Stony Brook, I'm looking for someone who's a team player. I'm looking for someone who is driven and wants to get the most experience out of their fellowship.
First I look, are they a well-trained OBGYN? So, have they had a good experience? And that's one of the questions I'm asking is, how was your experience as an OBGYN? The second thing that I'm really looking at is what else have they done? Do they have any research activity? I like to assess, how are they personally? Like, what is their personality? Do I think they're going to get along with myself and with the rest of this program? And of course, how do they interview? Can they speak? Can they talk to a patient? Do I want to be counseled by this person that I'm interviewing right now for whatever the problem is I have as a patient that I'm receiving the counseling?
Chapter title card, why is the Stony Brook MFM program so special?
I think the department supports our program. Our department is very positive in the fellows and the fellowship program, providing support for research activities, providing support for being able to go to meetings and be part of the greater maternal fetal medicine community.
We have a good balance between the maternal side of things and taking care of sick moms, and also a very wide breadth of fetal pathology and a lot of good hands-on experience with invasive procedures very early on and throughout your fellowship. We also have a lot of good unique populations we work with. We're a regional perinatal center and get all the referrals to Stony Brook on East Long Island, so it's a really good, well-balanced, comprehensive program.
I want to say at Stony Brook, the diversity of anomalies is such a wide range. To this day, after 21 years, I'm still seeing things that can stump me, that you're just amazed of what we see. We just see such a broad range of things coming through our department, so you will never stop learning.
We have a great relationship with the fellows. I think we work very collaboratively with them.
Gina Milone, MD, attending physician and assistant professor.
We spend time with them in different settings, both in times when they are acting in a supervisory role, and we're really there to be supportive, which I think is really important for them having that autonomy to develop their skills that will prepare them to be attendings. But then we also have other times where we are more in a supervisory role and they can learn from us and kind of see how we counsel patients. Similarly, for our academic time, it's very unified as a division where the fellows get to interact with their co-fellows, with the attendings, with our sonographers all together to learn from everyone's different perspective, no matter where you are in your career.
We have a very close relationship with the fellows.
Brittany Roser, MD, attending physician and assistant professor.
When we are on service, it is the fellows' service. And so as an attending, it is my job to be there and be supportive. You come up with the plans, and we are there to assist, working very closely together in order to allow the fellows to become the attendings that they will be.
The attendings are very supportive in our learning. They help us with our research and with our academic learning through conferences. And overall, they are just very supportive of everything that we do here in the fellowship.
The unique thing about Stony Brook is that the attendings really treat us more like colleagues rather than trainees while providing us with adequate supervision.
Stony Brook is an Accreta Center of Excellence, which means that we have a comprehensive multidisciplinary team.
Fellows pose in scrubs in front of a banner reading, "Proud to be an Accreta Center of Excellence,"
that works to take care of these moms with abnormal placentation. The fellows are directly involved with this, and they are coordinating the multidisciplinary meetings with both oncology, urology, IR, and all the different teams that we need to do to take care of these women and give them good care. So they are also involved with the actual surgical procedure where they are scrubbed doing the cesarean hysterectomies with the oncology team and the MFM team. So they are there from start to finish with us, and it's a really nice, comprehensive and continuity of care for the fellows.
Chapter title card. What does Long Island have to offer?
I'm from Southern California and I've always lived near the ocean. The Long Island beaches are definitely comparable to those in LA, and it makes me feel like I'm at home.
Well, I'm biased in that I'm from Long Island, although not from Suffolk County, but I really enjoy Long Island, definitely in the summer because of the beaches. In addition, even in winter, there's plenty of things to do, for example, shopping, going out east to visit the wineries or go pumpkin picking. Being on an island is very helpful to do any water sports and to enjoy even going across New England or the Mid-Atlantic. It's very easy to travel from here.
There's a lot of actually greenery on Long Island that I did not expect to find over here in New York, and the wineries, and kind of like our program, you have a lot of different things you can do here and access to things that I didn't expect when I came from Ohio.
So I have a wife and children, and one thing that was very important was a good school system and a safe area. But at the same time being close enough to go to the city to enjoy downtown, go close enough to beaches where we can enjoy spending time together.
There's some very pretty things in Long Island, some history that goes back to Revolutionary War time, some very beautiful places to see.
We're still within reach of New York City, so when my family and I crave the excitement of New York City, it's close enough. So there's a lot that is very good about Long Island outside of just work in the hospital, which I also enjoy very much.
Chapter title card. What one word describes the Stony Brook MFM Fellowship?
Comprehensive.
Balanced.
Family.
Compassionate.
Team.
Supportive.
I would say family.
The first word that came to my mind when I was thinking about what does this fellowship mean was strong. I think the fellows are probably the current fellows and the fellows who have come through this program are the strengths of this program.
The main one is a collegial program. We definitely have the fellow be part of our family.
Trusting.
Supportive.
I would say team.
Collaborative.
Engaging.
Well supported.
I would describe the MFM fellowship as well-rounded. I think the fellows graduate and they feel comfortable in doing a variety of things, both maternal and fetal-oriented, and I think they also are very comfortable doing any surgical skills once they leave, as well as counseling for those procedures.
Unique. We've got just access to all of the procedures that we could want, access to great research opportunities, and just really great relationships between everyone.
Chapter title card. What do you hope the fellows gain after their 3 years at Stony Brook?
I want the fellows to leave here with a positive attitude, with confidence that they can solve the problems even if they don't know the answers to them right away.
Some people choose just to get strength in one area, could be fetal or could be maternal. Some people wanted a broader approach, and we really kind of tailor the fellowship to what they wanted to get out of here.
I would like the fellow to be very, very conversant with the basic knowledge of the different complications we see during pregnancy, and be in a position to be aware of the current literature, and be in a position to discuss where the literature is strong, where it is not, and conform some ideas on where the fertile grounds for research will be.
Being able to be independent, but also being able to reach out to someone that they trust, that they can ask questions on. Because we always have questions when we start new, always, all the time. And to have that support is huge.
I think that our fellows get along very well with each other. We are all team players, and there's a lot of camaraderie among us. So I would like to continue that spirit and really find someone that fits in well with our team player spirit, and just always striving to get the most and the best out of our fellowship, because that's really our goal as fellows, to take these next 3 years and get the best out of it that we can.
Closing graphic. Hundreds of people viewed from above are arranged to form the Stony Brook Medicine Shield logo. End card. Stony Brook Medicine.